Hello, everyone. Good evening. Welcome to Gentry's Journey. I'm your host, Carolyn Coleman, and we have two subject matter experts that are here, husband and wife team, which is great to have. And they're going to be talking about hydration and wellness. I'm going to allow them to introduce themselves and tell us about their business. So, Denisha, go ahead.
Yes, hello everyone. My name is Danisha Opoku. I'm the owner of Liv Hydration and Wellness, and we are a mobile IV hydration company. So that means we come to you delivering high quality vitamin IV infusions and injections that help improve your overall wellness, help you hydrate quickly and recover faster.
Okay. Now, Mr. Poco, what role do you play in this?
I'm the COO. My role is mainly as a supportive role, kind of being in the background, make sure that logistically we're sound and that we're able to provide all the services that we need to our different clients, make sure that things just run smoothly in the background.
Oh, that's great. Okay. Now, and any of these questions for I know you say your background, but the question is basically hydration and wellness. How did you guys get started on this journey?
Well, the idea actually came to me. I was in the ER one day. I was suffering from dehydration. I was having symptoms of just extremely fatigued, had some palpitations. I didn't really know what was going on with me. Of course, I'm a nurse practitioner. So I was working a lot, not really doing what I needed to do to take care of myself. And they told me I was dehydrated. So I had to get some IV fluids. And after I received those fluids, I just remember feeling like, wow, I feel so much better. And I just thought, if that's all it took, then I could have done this myself. And so just started doing some research and I found out about IV hydration as a concierge business. A lot of like party towns were doing it, like in Vegas, they were doing hangover cures. And I just started researching all the vitamins, the hydration, all the fluids, and seeing how I can do that to make people, especially busy professionals like myself, people who work out a lot, and just people who are on the go a lot. How can I bring them hydration to them, meet them where they are?
That is good. And that was going to be one of my questions regarding hydration when people have overindulged in their
Hmm.
preferred beverage. I was going
Hmm.
to ask, is that one of the services or one of the reasons? Because alcohol can be dehydrated.
Hmm.
So I'm glad you answered that. Now we'll save that for later. But I It's a concierge service, so that's great. So we're going to say that you basically go into the homes of the lifestyles of the rich and famous, helping them out, right?
Yes, and actually everyday people.
I know every yeah, but that just fell in my head, and I was like, that would be perfect. That's good.
Yeah.
That is good. That is good. Now, you gave us what are some of the common conditions or situations that might require home IV hydration?
Like you mentioned, overindulgence. Also people who are preparing for travel or coming back from travel is hydration is really good for jet lag. People who are suffering from minor illnesses like the cold or the flu, and they need that extra hydration and vitamins like vitamin C to help boost the immune system. After a workout or pre-workout, we have different vitamins like amino acids that help build those proteins back up. People who are looking for brighter or hair, skin, and nails, we have IV infusions with biotin in it, so that helps grow the hair, skin, and nails. And weight loss also. Some of our infusions have ingredients that help boost metabolism and help with weight loss. Also, migraine. We also have a migraine and pain relief formula. So we have a formula for a variety of different reasons.
Okay, now you go in and basically do the assessment. Do they call you? How do you get connected with, let's just for lack of a better term, your clients?
So have an online booking platform so they can book online or they can call or text. So either one.
Okay. And then when is the assessment? When does the assessment take place?
The assessment takes place on the first infusion. When I, if it's your very first appointment, you get a full head to toe assessment. We look at your medicines, we look at other health conditions you may have, just make sure that you are fit for IV infusion. And then every infusion, you get vital signs taken before your infusion.
Okay. So, how long typically, and I hate to use the word normal, but how long does it take for an infusion to be complete?
Say max about 45 minutes.
Okay.
Most infusions can go in about 30 minutes. But I tell people just give it about 45 minutes because it all depends on like the vein size, usually, how dehydrated you are. But we can be in and out in less than an hour.
Okay. And that was going to be one of my next questions. Also, it's IV therapy basically.
Mm-hmm.
And okay, with dehydration, we know sometimes the veins aren't cooperative. So,
Right.
how does that work for you?
Well, I've been a nurse in the nursing field for 17 years. Most of my nurse, all of my RN experience is critical care nursing, so I'm pretty good with veins and getting the stick. So, if they're really dehydrated, we have smaller IV catheters that we can use, but we usually get the stick.
Okay, great. Um, how do you ensure safety and sterility during the process?
So we only use sterile vitamins, sterile IV fluids. We do maintain, the proper sterile procedure when we're putting the IV in. We make sure everything is clean. We wipe down any surfaces we may use before we start. Of course, we use gloves, but we make sure that everything is clean and safe and appropriate.
Okay, all right. Are your patients pretty cooperative regarding the procedure?
Absolutely, because it's an elective procedure. They're calling because they want this done. So most of them, well, all of them, they know what it entails. They know that it's getting an IV. If somebody doesn't like to be stuck or they don't like needles, then they don't call you to come and do an infusion. So we don't have any problems with someone not wanting to get stuck because they know that it's going to be a needle involved. They're going to have to get an IV.
Okay, because being in the hospital, when you tell people you're dehydrated, we need to start an IV, they get
Right.
squeamish. They be all over the room. Oh no, no, that doesn't happen. So I'm yes, like you said, it's elective, but I know
Mhm.
people. Sometimes they change their whole mind about everything. Have you ever
Right.
had that to happen?
I have not had that to happen. And
Right.
mostly, like I said, it's elective and people are paying out of pocket because insurance does not cover this. So
Okay.
they're paying out of pocket for this service. So
Hmm.
if they're paying for it, they know what's coming and they're pretty cooperative.
Great. Now, do you have repeat clients?
Yes, I do. I have a lot of repeat clients. I would say half of my clientele, or more than half, are repeat clients.
That's great. That's great.
Mm-hmm.
Because that speaks volumes in and of itself
Mm-hmm.
to have the repeat clients. Now,
Yeah.
what type of education goes into this?
So we do give people a rundown of the vitamins, especially if they call and they don't exactly know what they want. Then I'll ask them about their symptoms, and then we'll go down the list and we'll tell them what vitamins are in which infusion, and we also customize infusion. So we do a lot of education. Like I said, I'm a nurse practitioner, so education is key for me.
Okay. besides the IV fluids, what other, for lack of a better term, medications do you administer? I know you mentioned the biotin, um, for hair and nails. What other?
So we have B complex, we have magnesium, B12, calcium, vitamin C. We have amino acid blend, glutathione. That's one of our really powerful antioxidants that we use. And we also have medications. So we have an anti-nausea medicine, anti-inflammatory medicine, and a pain relief medicine.
Okay, good. So you basically have covered that full spectrum of that.
Hmm.
Okay, now we talked about the sterility of everything. Are there any potential risks or side effects that you look out for or that you educate the patient or your client that may occur?
Yes, we do educate on just the insertion site. That's the biggest risk, because veins can blow, um, and people may have bruising after the IV is taken out. So those are the major risks. It's just the veins, the access point. Um, Not really any side effects I can think of for the vitamins, unless somebody isn't allergic to a vitamin in itself, but you can't really overdose on vitamins. So if your body's getting too much vitamins, then you'll excrete it.
Sure, sure. And during that education, you let the patient know, do they ever try to do they self-administer anything or are you on site each and every time?
No, I'm on site each and every time.
Okay. All right. So you don't really need a caregiver to assist with this.
No,
Okay.
the nurse handles it all from start to finish. And we're
Okay.
right there with the client the whole time the IV is going through.
That's good. Okay. So, emotionally, are your clients ready? Are they just ready for it? You don't have to do any, I know you do the basic education of introducing yourself, telling what's going to go on, but any emotional or psychological pep talk, is any of
Yeah,
that needed for
I
them?
have run across a few people. Like I say, even though they know that they're getting an IV infusion, they still have some anxiety when it comes to needles.
Okay.
So I do have to hold hands sometimes and walk them through.
Mm-hmm.
Or somebody may have a family member or friend there with them that'll like hold their hand, or they'll just look away. But that does happen.
Okay. I mean, because that's normal. That that
Hmm.
really is an expectation. That's people for you. So that's
Right.
great. Um, so how often or do you have I'm not repeat offenders, but you have a clientele that wants routine therapy. How does that work?
Um, we have people pretty much on retainer. We've got a couple of clients now that want infusions weekly, and some that want it semi monthly, so
Okay.
bi-monthly. Sorry. So we work those into our scheduling and make sure that everything that we're setting up for them fits their symptoms and their needs.
Yeah, we
Okay.
have subscription plans that they can subscribe to.
Okay. Oh, that sounds great.
Mhm.
So once you've done everything you need to do, what type of follow-up do you give your client?
We typically follow up with an email and a text message just to make sure that they're feeling okay or they're feeling better. They have any feedback or anything like that. We typically follow up the next day.
That's great. Um, one dentist, and this is just my personal thing, um, after he called it a difficult extraction, and I'm not going to say that it wasn't, but I've had worse. And he called me several hours later, I guess closer to bedtime. And I just so appreciated that, out of all the dentists that I had been through, rarely do I get a call back to see how you're
Absolutely.
doing. To me, that is just a plus. Okay. Now,
Right.
when I've had the
Same.
the oral surgery, yeah, because it's kind of like surgery. They follow up. But the first time this gentleman did it, it was prior to me ever having any oral surgery or anything, but I just went, now he's got my business for life. That's basically how I felt. I kid you not, because he demonstrated that I wasn't just a patient. It was someone that he cared about. He wanted to make sure what he did went well. And so
Mm-hmm.
I just much appreciated what he did. So I know that follow-up does help. And
Mm-hmm.
does that help you
I
guys?
feel the exact same way. Yeah.
Okay.
So that's why I do think it's very important to follow up the next day, the same day on my patient. I try to do that for every single patient, just follow up with clients, follow up just to
Hmm.
make sure that they are feeling good still and see if there's anything else that they need. So I'm with you on that. I've experienced that from a doctor too.
Hmm. And it makes you feel better as opposed to being
Yes.
on that conveyor belt, as I call it, with Lucy and Ethel eating those chocolates. They just lost control of the game, but it just makes you feel like you are more than a patient to an individual. You're more than just a paycheck for them. And I just, hats off to him for doing that. Hats off to you all for doing that because it does make the patient feel as though you care. Okay. Um,
And on the flip side of that, it also it makes us feel better and making sure that we're following up with those clients puts us at ease, making sure that we've given them the services that they greatly needed at the time. So it's also beneficial for us to get that follow up and that feedback.
that's wonderful. I mean, absolutely wonderful. Now, are there any new things on the horizon you're thinking about adding to your protocols or the list of things that you do?
There is one new thing that we will be implementing this upcoming Friday, and that's one of the weight loss shots, not the GLP ones that everybody is getting,
Craving.
but this one it has the amino acid and a B complex blend. So it helps burn stubborn fat, helps increase your metabolism, helps with your immune system. So it helps with a lot. So we're looking forward to implementing that on this Friday.
That's great. Okay. Now I was in one of the local pharmacies, maybe about a month or so ago, and I looked around. I'm always looking. I'm not saying looking for anything in particular, but just trying to be aware of my surroundings. And I saw what looked like a container, a box, if you will, and it said IV hydration. So, yeah, I was like, really? I could just walk in to this pharmacy and just pick up my IV hydration and take it with me. Uh,
Huh.
yeah, I'm not gonna call their name, but I mean, it was there on display. It wasn't hid. It was not behind the counter, where the pharmacies are. It was right there, counter like next to the Tylenol. Okay, so I was like, wow. I didn't realize. But when you're not in that profession or that arena, you don't know really what's out here if it's not a part of your toolkit. You just don't know. So I was surprised to see that. And I had so many things going through my head, like where's the IV pole? Where's the IV tube? And where's I mean,
Who's
I didn't
going
know
to
I didn't pick
administer this?
yeah.
Um, yeah, after we talk, let me know what pharmacy that is. I need to go check that out.
Yeah, you will. I'll be happy to let you know. You know,
Yeah,
but
that's very odd
it is
because
very odd, and I had to pick up a prescription, let's say 1 week, and then they called me in something else like 2 weeks later. and it was still there. So, but
Hmm.
I wasn't curious enough at the time to pick it up and go reading like I normally would do. I just wanted to get my stuff and go. But I said, if you're in here next time, I'm picking you up. We're gonna do a read down, okay, to see just what's going on. Because I curious minds want to know, right?
Oh, I don't know about that.
Yeah, yeah. It was in like a little, Ensure used to come in a box,
Hmm.
like a juice box or something like that back in the day. Um, so it was in a box, but it was, it was maybe it held I'm gonna say 1,000 milliliters. It was that size of a box. It wasn't tiny. So but yeah, in fact I need to pick up some scripts tomorrow. So I just don't want to go back out today.
Picture.
I will take a picture and we're gonna read it. We're gonna see what
Yes.
what the deal is. And I was like, just right here, huh? Just right here. I didn't open. Like I said, I didn't pick it up. And it's not that, I was like, wow. This is different. We're really moving with this hydration thing. But I knew I would have you guys on as a guest as well, but I didn't venture off into that. Sometimes you just want to grab your stuff and go. But I was
Right.
curious enough because it stayed in my mind. So I said next
Hmm.
time I will pick it up, read it, see what's going on. Um,
Yeah. Interesting.
it's very interesting. So, what type of signs and symptoms do your clients have? That I know you mentioned the migraines. I know we mentioned the overindulgence of beverages, but is what type of signs and symptoms do they call you about the most that they want to be addressed?
The most thing I get called about is just low energy, fatigue, and stress.
Okay.
Yeah. So those are the most complaints. A lot of people know we're busy, we're on the go. A lot of people are just having just low energy. They can't really get up and go like they used to, or it takes them a longer time to recover when they finish doing something. So just those few things are the top ones we get called about.
Okay. And that truly makes sense. Sort of like a PRN, a PRN need.
Right.
Okay. Now, is there anything new on the market coming up that you're aware of that's in that scope of practice, or has there been any talk?
The newest thing that I've seen is IV CBD.
Really?
So there are reportedly a lot of things that the IV CBD is good for. Even energy. So energy, stress, sleep. They're using it in some people who may have like substance abuse problems. Um, they're using it for pain, for chronic pain. Yep, pain management. It's a lot of things. So some type of way they were able to formulate CBD in the IV mode. So I've been seeing a lot of chatter about that.
Hmm. Okay. All right. Um, and now I know you said that the your clients contact you. Now, is there an additional telehealth component to what you provide?
There's not now, as we grow and expand and we can hire more nurses, there will be telehealth, because every client has to have an assessment by a provider. So now with me being the provider and the infusionist, I do it all in one. So
Okay.
as we grow, we will do telehealth assessments before the nurse goes out.
Okay. And that was another sticky point with me, but after I got accustomed to it. And I think anything new to a person brings on anxiety.
Yeah.
So, like, yeah, how they gonna know? How they gonna see? How they gonna? But when I saw it in action, it made so much sense. Especially, I
Yeah.
saw neurologists do a telehealth with the patient coming up from the emergency room, and I was like, and she did a full with us there to assist. I was just there to get my curiosity and to understand the process. So, but with the
Mm-hmm.
nurse helping the patient to do what, reinforcing what the doctor was asking to be done, lift this hand, lift this arm, do this. And, the nurses, because he said he just could not hear. He was young man, he just had a hard time hearing. And I think that was part of his quote unquote neuro symptoms. So to see that in real time and the type of equipment that was used for it, for her to do the assessment, I was really I know nobody's looking for my opinion, but I was very impressed because, when you're a healthcare provider, you want to know because people call on you, whether you want them to or not. And I'm sure you have family members and friends that call on you and ask you about various things. So I don't mind being informed so that I can either make them feel comfortable or say, yes, this is what's going to happen. This is what you need to expect. But also, talk to your healthcare provider. Let them know what your angst are. Let them know if you're uncomfortable. A lot of people talk about they want me to go in the portal, Carolyn. They want me to go in the portal. I said, that's not mandatory. You can call your doc and ask them to explain to you what is going on. And they were like, really? So they make it seem like the portal is the end all to be all. And you can always speak to your physician. If not your physician, your nurse practitioner, whoever is available to answer those questions. Because just because you get the lab work, you still need somebody to explain to you what it means, right? I don't
That's
know
right.
if the portal goes into detail about those explanations. And I just had that call Friday. And I said, don't be embarrassed because I'm not raising my hand, but I don't use the portal. He was like, you don't? I said, no, I want to talk to my people. I want to talk to him. And he was like, oh, okay. I said, no, there is nothing to be embarrassed about. You're busy working, you're trying to do your job because most of my clients are still employed. You're doing your job. You don't want to go on a computer at the end of your day to see what the portal says, and then you still don't understand what's going on. Just tell them to give you a call. They'll give you a call because if you're not
Right.
getting the information, who is that benefiting? It's not benefiting anyone. So he said he was going to do it, and most of them will tell me because one guy told me I'm having a hard time with my vision. They didn't get my glasses right. I got a cataract going. I said, just call them. We still
Yep.
are not that far removed, even with all this technology, that we can't speak to our healthcare provider or leave a message. And I said, have them
Absolutely.
call you back and explain things to them and let them know that you can't get your eye appointment, you feel like you're cataract, you're having blurred, you can't read the portal. So if you can't read it, how is that helping you to gain the knowledge that you need? So you may be
Absolutely.
missing vital information from the lack that your vision is impaired. And he was like, okay, I'll do that. So I'm like, okay, there goes two of them that I've taught this to. I hope I'm not breaking any rules, but if you don't want to talk to your patients, what do we have? We're
Yep.
going to be in a circle. We're just going to be going in a circle, but most people will call you back at a certain time, whether it's, within 12 to 24 hours to explain to you what's going on. So that's another thing about the telehealth. And I learned today that since COVID is essentially quote unquote over, no more telehealth visits because the insurance is not going to pay for it. And I was
Mm.
like, okay, cool. Now I know because every 6 months a visit just to say, hey, how you doing? That can be a telehealth visit. Now, if you need to go in, that's different. So,
Right.
so you don't know if you don't ask, and I always
Right.
tell people, just ask the question, just ask, and we'll go from there. And it's okay to ask a question. If you can't ask a question about your health, what are we doing? And that's just like a product. You're not going to go in Lowe's and just pick something and it's not right for what you have going on. You need to ask questions about, I don't know anything about building repairs and stuff like that. I have to ask the question. So,
Right.
that's it on the telehealth. Anything else you can add to it?
As far as telehealth,
Yeah.
I personally think telehealth is a great tool, like you mentioned, especially when you're dealing with rural clients or clients that may not be able to come in to the health center or the doctor's office, wherever you are. 'Cause that's what I do on my 9 to 5. I work in a FQHC. So we do use some telehealth as well as regular office visits, but some clients can't come in. They may be, they may not have a ride to the doctor's office, but they do have a phone and they can connect on the phone and do telehealth visits. So I'm all for telehealth. I think it's a great tool, like I said. So
And I agree with you. Yeah, I mean, nothing is perfect, but and I'm glad you brought up that about some of your clients are rural, but all of your clients are basically paying clients, correct? I mean, they pay out of pocket for what you have going on, but they're
yeah, correct.
still rural, and that's
Mhm.
still a long drive, so to speak, 9 times out of 10. So that can be a day's work in and of itself. Trying to think of how to put that. I'm glad you brought that up. That it's just not the inner city or the surrounding areas, but you operate outside the surrounding areas as well. Because people need care. Some people prefer to live, have that rural living, and some people they have been there all their lives and they don't want to come into the city.
Right.
Okay, so logistically, what challenges do you face when you're doing your home IV therapy for a patient?
Logistically, it's just, basically depends on where the clients live.
Mm-hmm.
So if, of course, if they're too far away, I do serve Bessemer, McCalla, Birmingham, and all the surrounding areas. Um, but if they're living like in Leeds or something like that, we don't go that far. So it just depends on where the clients live. But once, we get there, we get into their homes, you pretty much you set up where you are most comfortable. And then we work around you.
Okay. So you work with their schedule and they work with
Hmm.
yours. That's great.
Yep.
Because it has to be. It's just, well, it is a healthcare visit, so it's like home healthcare visit. And a lot of times they'll call you, I'm 30 minutes out, or I'll be there in an hour, things of that nature. So you make those phone calls to let them know what your time span is. Um,
Right.
Okay. And that's good because I know they are anxious and they're walking through the house, peeping out the window to make sure that you're
Right.
warming up. So that's good in and of itself. So you gave us the benefits of the IV therapy. Um, how long have you been doing this?
How long?
Yes, how long have you been doing your
We've
IV
been
therapy?
we've been in business for a little over a year. We started officially launched in May of 2024.
Okay. So that's good. So have you seen an uptick since you started?
Oh, yes, definitely.
Oh, that's
Def-
great.
yeah.
That is great. Um, so what else would you like for the audience to know about you, your company? and your services, if we haven't covered it all already.
I think one thing that we haven't covered is because some people may say, well, I can just take vitamins by mouth. And you can. However, getting your vitamins through the IV route, you get the benefits almost immediately because the vitamins and the hydration is going straight into your bloodstream. Versus if you take them by mouth, you still have to digest it and you're not getting 100% absorption. But the IV route, you are getting 100% absorption. So, like I said, you feel those benefits almost immediately. Um, Most people, as soon as before the bag is even finished, like, oh, I feel good. So it's definitely an energy booster, a mood
Mm-hmm.
booster. And like I said, it's convenient because we come to you when you're feeling bad or if you're tired, you don't want to have to go to a clinic, wait in line, sign in, do all that. You can get all those benefits from the comfort of your own home or your office. We go to offices, we go to events, but you can get it, where you are. So if you considering IV hydration, give us a call. Or if you just want to talk about it or you have some questions, you can give us a call, you can text, you can email, and then you can go on our social media as well.
Okay, and give us all those sites and the ways to communicate so the listeners will have it. Okay.
Yeah, so you can call or text at 205 800 4032. On Facebook, it is Liv Hydration and Wellness. And same for Instagram. It's Liv hydration and wellness.
Okay. Okay.
And then also the email is info at livewelal.com.
Okay. Great. Great. Because after all this good information, we definitely want them to be able to get in touch with you. Okay.
Yes,
Um,
and also the website is www.livewelal.com.
okay. Okay. Well, those are some great takeaways. Um, Very good takeaways. I can't remember because sometimes I have the television on for noise when I'm working. And I think someone was saying, I don't know if it was television or radio, that they get their IV hydration and they love it. And they quoted the benefits that you quoted. I just feel better. One time I had a couple of friends who weren't feeling well, so I called up and they came in and we were all feeling better at the end of the visit. And I was like, well, that's pretty cool. So I guess they may have had like an IV party. But
Yeah.
but like you say, when you are drained, because a lot of people are busy, um, do you have one particular dynamic or one particular set of people that are more that come to you more? And I hate to break it down, but men versus women and the age groups what age group do you have?
Yes, I do have more women in their 30s to 40s. Um, and they are, like I said, busy professionals. They work out. Um, they try to stay healthy. Um, yeah, I think that's a big majority of the client.
Okay, because I can see it. Believe it or not, I used to be in the gym a good little bit,
Mhm.
5 to 6 days a week. That was pre-COVID. And COVID changed a lot.
Yeah.
It just changed a lot of, some of our routines, our dynamics, but I'm getting back into it. I mean, I still exercise. I just was not exercising 2 hours a day. Pre-COVID was 2 hours a day. And when COVID hit and we were on lockdown, I'm walking 30 minutes. So that's an
Mhm.
hour and a half that I no longer am utilizing. And
Right.
it shows up after a while. You're wondering why you're feeling sluggish. You're wondering why you're not where you were. Where is your energy and things of that nature? So I had to do a lot of personal reassessments. I need to walk at least 45 minutes. And that would be my goal if I walk or if I'm on the treadmill. If I see a park, I keep a pair of gym shoes in the car and I don't have anything else to do, I jump out and just go walk. Okay, at a local
That's
park,
good.
no matter what part of town I'm on. So I mean, safety is always paramount, but I'm saying that's what I would do. And it's some that you like better than others, and it just kind of keeps you going. Because a friend of mine was like, "I want to walk with you." I said, "If you're not a walker, this is a 2 mile track." She was like, "What does that mean?" That means we're walking 2 miles there, and we're walking 2 miles back. That's a total of 4 miles. And if you're not a walker, you might want to rethink this, or we need to get a plan now. Because once I get started, it's kind of hard for me to stop. And so she's,
Right.
I want to see the whole thing. Oh, she was exhausted when it was over. Okay. We have to warn people. Let's take it bit by bit. Yeah, it
Right.
looks cool to be out there walking, with the other people, but you have to understand they do this all the time. They're not just jumping out. You need to start at 30 minutes. I tell everybody, yeah, some people who have mobility problems, I said, you need to do 10 minutes there and 10 minutes back. That's 20. That's 20 minutes that you didn't get, and you work your way up, to where you want to be. You set your goal. But I did hear that. Don't remember exactly what show it was on, but they were touting the IV therapy, saying that it really made them feel better. They were more energized, and so it was just good to know that that's out there. And it was definitely great meeting you guys at the event, because I had so many questions because I'd never seen it before. And it was funny after I talked with you guys, I see this on television. People like, oh yeah, we do this all the time, and it just makes
Mm-hmm.
my skin look better. I feel better. I have more energy, and I'm like, wow.
Mm-hmm.
So this is a growing trend. So I can't help
Mm-hmm.
but to say congratulations to you all for moving
Thank,
forward on this idea.
thank you.
Okay. So, with that being said, is there anything else you would like for the audience to know? Come on,
Just
Mr.
piggyback
Phil.
some of the stuff that Denisha had said earlier. Part of our business model and core values is to make sure that we're personable, efficient, and affordable. So we come to your home, make things more efficient for you, more personable. Make sure that we follow up with great care, and we get that necessary feedback to make sure that we're giving the best care possible.
Yeah,
We
quality
just want
of
to help
life.
people live well.
Absolutely, absolutely. And you're doing your part. So kudos to you guys. Absolutely. Kudos to you guys. Well, I think that's it, unless it's something else you want us to know. Um, Give us your contact info one more time, please.
Yes, telephone number. You can call or text this number 205-800-4032. The website is www.livewell.com. Email address is info@livewelal.com. On Facebook, it's Liv Hydration and Wellness, and the same for Instagram, Liv Hydration and Wellness.
Okay, great. Thank you all so much. I do appreciate your time. I do appreciate your tenacity. And Great idea, great product. I want to hear good things in the future on how well things are continuing to go for you, okay?
Awesome. Thank you for having us.
You're
Thank you.
more than welcome. Thank you for coming on Gentry's journey and sharing about your brand.
Thank you.